Hi everyone. Well, today is April 30th and it's a Monday, and today I'm actually going to go take my state boards for my PN, which is for practical nursing. So I have a lot of things going through my mind right now. I'm trying to keep positive, think positive, because you know, there's this quote that I really enjoy, and well, it goes like this: today is the tomorrow that I was so worried about yesterday. And this is a proverb that I found somewhere on the internet, and I just thought it's brilliant. I mean, it makes a lot of sense, knowing that we get so worried and worked up about what tomorrow is going to be like, but then once tomorrow comes and it just becomes our yesterday, and then we wonder why were we so worried about that the day before. So I just kind of keep that in mind, like once we pass by a certain day, a test or something that challenges us, we accomplished it. So that's just the main positive thing to think about, is that we accomplished what we set our hearts out to do. But so far, I've been out of school for about a month now, and since that time I've just been prepping and doing NCLEX questions, a lot of NCLEX questions, just touching up on all the different subjects, the systems of our bodies, trying to go more into the drugs, because there's going to be a few questions on the exam on knowing what is abnormal, what to expect, and things like that. So I really have touched up on different classes of drugs, and knowing some of the main hit points for side effects and stuff like that. So I know I'm far from knowing it well enough to actually be able to educate it to a client or patient, unless like I've actually looked at it and read it in the drug book more thoroughly. Then I would have a little bit more confidence to do so. But so far I can just name off maybe like one side effect of some certain drugs, So, but yeah, I have been taking a lot of notes. As you can see, I have these little notepads, and they come in handy because, for me, I'm a visual learner, so I like to write things out and see it, draw pictures, make any kind of little side notes. So I have a lot of side notes. I don't know, it just is a good reminder for me. They're like little post-it notes for me, to remind yourself to do this, to this. Oh yeah, I've been using Saunders PN and NCLEX Review, and there's a CD-ROM. So I've just been mostly just doing the questions off of the CD-ROM. There's a lot. I mean, it's helpful too. It really goes into the systems, and so I recommend it. I've also checked out two books. One is the Kaplan. It's a 2012 book, and it has 145 questions in the back, and it has really, really good testing strategies on what kind of questions, the style of questions that are going to be put out in the exam, because it's really, really good to know how the testers, the creators of the test, how they're trying to test you in your knowledge, in your critical thinking skills as a nurse, what you would do in a situation, in a case scenario. And usually, you're always going to be the LPN. There's either going to be priority, like what patient you're going to see first. You're going to see the unstable patient first over the patient that is going to go discharge home pretty soon. They're going to want you to know, again, for priority, you want to always make sure if they have issues with breathing, and bam, that's going to be the answer, hands down, on multiple choice questions. Maslow's hierarchy of needs, you want to hit the physical needs first over your psychosocial needs, because physical needs definitely is a priority. Things can go wrong. You want to make sure that that patient client they have oxygen, adequate oxygen. You want to make sure they have good nutrition, so food and water. You want to make sure that they're well altogether. So those are the main things. And let's see, know your lab values, because it makes no sense, no point in answering a question if you don't know the normal ranges for certain lab values. So memorize, make flashcards. It's going to help you in the long run answering questions and to know what to expect. Mainly, just keep doing the NCLEX questions, just seeing how test questions are written, because they're not going to be like in school. For the NCLEX questions, the styles that they have it's going to be like, you have this situation, this client has just came out of surgery, and like we'll say thyroidectomy, and what should be the priority when they first come out of the OR. You want to first check for like airway, breathing, circulation. So you want to make sure that they're breathing okay, that their circulation and all that is going good, and that they're not bleeding from their neck, because that's a huge risk factor that comes about when you have a surgery, any kind of surgery. So they're going to be at risk for hemorrhage. So you want to practice as a safe nurse. Know your 5 rights of medications, giving medications, because medication errors is so huge. Death has occurred because of just careless medication errors. Just make sure you're double checking your order, questioning orders, asking questions. Just take a little flavor, bite of everything, every little category that NCLEX is going to ask you. So you're going to learn about leadership. You're going to learn about health and maintenance, physical hazards and safety. You're going to learn about the physiological aspects, because you want to know the systems. That's what we are composed of, is also known as homeostasis. So we want to make sure that we're in homeostasis all the time. But if we're ill, if we have massive diarrhea, or something going on, it's going to alter our insides, our electrolytes, and everything is going to be all out of whack, and we'll just be sick. And so that's where the nurses and doctors and medical care comes into play, to hook them up to some IVs, give them some saline solution fluids to hydrate them and get them back into a normal homeostasis. So yeah, it's been an incredible 1-year journey, from my LPN starting point up into graduating, and then now to finally boards being here. So do I sound ready? Do you think I'm okay? I feel like if once I see the question and I see the possible answers, usually I find hints and points from the question itself, and then I can usually answer correctly. But hopefully that's the case with NCLEX. But yeah, so I will let you all know how everything went, and feel free to post any kind of questions about your experiences with going through nursing school and taking boards for the first time, or whatnot, and any advice that you would give, and stuff like that. So I hope everyone has a blessed day, and hope to talk and see you guys all soon. Bye. Now it's about 12:20, and I should start to really get ready and go fill up my car tank and say a little prayer for me.